You finish late, have cookies for the webinar. Okay, good, thank you. Go home and enjoy the webinar.
I just started it. It's recording automatically.
How many, do we know how many people we have there? Or we don't know?
We had 7 sign up.
Really? Good.
3 participants. Oh, wow. Look at them all joining.
That's the patient that just left here. Betty was this morning. Grace.
Oh.
Grace that's the one who brought the cookies.
I don't know. Can you see me?
Who is that?
Grace?
It's Grace.
Hello, Grace. We just getting ready.
I can see you.
You do? Okay. We're almost getting there.
Yeah. I tried to do it on my big computer, but I couldn't do it. So I'm just on my phone.
Okay. Oh, Ashley is there. Yeah, so I'm not sure that we'll ever, unfortunately, if we'll ever see you guys. I'm not sure.
Oh, and I've got lipstick on and everything.
Oh, man.
Oh,
I know.
you. Oh, and you're not having the mask.
That's right, and no mask.
Oh.
Did we ever come back to the hearing?
So I'm letting everybody talk for now, but when we get started, I'll probably ask you all to mute the diminished background noise and to allow our information to come out as clear as possible. I'm just counting here. 5.
So now, is there something I should do that I could, so that you could see me?
I don't know, Grace. You could try down in the bottom left.
Yeah.
Your screen, you could see there's a video camera. And
okay,
if there's a red line through it, then you could try clicking on it to
okay.
No,
I don't have it.
Yeah, everybody else people have muted themselves, which is great.
Hi,
okay. So I haven't muted myself yet.
Yeah, don't mute yourself. We're not until we start the presentation.
Yes, yeah. Okay.
It's just because when a lot of mics are on, it's harder to hear the presenter.
Okay.
Hi, Roy. That's great. And Catherine. Catherine's our
Betty. Hi, Betty.
Thermography clinic.
That's so good.
Good evening, Dr. Erin Kempt.
Hi, how are you?
Hello.
I'm great, thank you.
So unfortunately, you're not making it down from New Brunswick for the thermography clinic until April, I heard.
That's right. Yeah, so I've booked them in my calendar, so I have extra time that if I need to quarantine, I can in April. So I'll definitely be there in April for sure.
Yeah, we're looking forward to hosting you.
Hi, Catherine.
Hi, how are you?
Good.
There. So I think that's, oh, we have 8.
8.
That's great.
Okay, keep going.
All right.
Wow. That's good.
That's good. So it is 7:31. So I think we will get started. So what I'm going to do is I'm going to share my screen. I'm just going to share my screen, but I'm going to stop my video for a quick minute here because I want the presentation to take up the whole screen so you won't be oh, hang on a minute. Yeah, just so you won't be sidetracked by our beautiful faces. Okay, hang on. And I am just not, oh my goodness. I'm going to go right to the beginning here. There we go. So does everyone see our home screen here with our logo?
Yes.
Yeah, great. Okay. All right. But you don't see us anymore, do you?
No.
Okay, just checking. All right, everyone. Thank you so much for coming and sharing your evening with us tonight. This is my very first webinar and Dora's as well. Thank you so much for attending, and we're excited to be here with you today to share our knowledge with you on low intensity laser therapy. So first of all, I thought we would introduce ourselves. Many of you do already know us. However, my name is Dr. Erin Kemp-Sutherland. I own Choice Health Center with my partner, Saba Chisti. She's a physiotherapist, and I'm a chiropractor. And I've been practicing for over 16 years. I founded Choice Health Center almost 12 years ago now. I'd practiced in some sports medicine clinics in Toronto and Waterloo, Ontario. And then I started back out here at where I'm from in Nova Scotia. And I've been incorporating laser therapy into my practice with much success over the past 16 years. So with me today to help me present this information to you is our laser technician, Dora Hernandez. Dora is actually a family medical doctor from Cuba. She immigrated to Canada after 14 years of family medical practice in Cuba. And she was introduced to laser therapy during her time working as a lab technician at the QE2. It was actually on the recommendation of her phlebotomy professor that she looked into laser therapy. So she went on to study laser therapy and became a technician and has been working with thousands, literally thousands of laser patients over the last 14 years. Dora just whispered to me. Yes, I did. I did press record. We're so green here. Now, so that's us. And so who is Choice Health Center, or what is Choice Health Center? So Choice Health Center is actually Atlantic Canada's largest privately owned multidisciplinary clinic. So we offer chiropractic, physiotherapy, acupuncture, naturopathic medicine, massage therapy, and we have a kinesiologist, a podorthist. We offer yoga, Pilates, and concussion management. And so at Choice Health Center, our goal is your goal. So whatever your goal is, whether that's maybe to keep up with your grandchildren or run a marathon, we work in a truly collaborative manner with you off of one chart together as a collaborative healthcare team to get you to reach your goals. So basically, we want you to thrive, whatever that means to you. We're here to help you thrive and get you there. So we believe education is knowledge. So why we've started these webinars, and this is the first of many to come, is because we believe that education is knowledge and knowledge is power. So we feel that by reaching out to our community in this way through educational webinars like this, we're taking massive steps towards helping our community to thrive and just be healthier. And so what makes Choice Health Center different? We're actually so different that we have coined a phrase. It's called the choice difference. You might have heard of it. So what the choice difference is there's a few clinics, or a number of clinics out there that do offer all of the services that we offer under one roof, but it's the manner in which we work that separates us from those other options. So even though these individual professions may work under one roof, they're working in individual silos. And so, each practitioner tends to work on building their own practice, and they may only refer on to the next practitioner, when something doesn't work, or when insurance money runs out and they reach the top and they have to move on to something else. But oftentimes what happens is that referral doesn't happen, and the patient only ever experiences one silo, meaning one practitioner under that one roof. So the choice difference is actually a synergistic approach to care, and synergy is the belief that the additive effect of two or more inputs is greater than each component would be separately on its own. So you've kind of heard of it before. The whole is greater than its separate parts. So an example in this case would be that your injury's response to, say, chiropractic combined at the same time with, let's say, laser therapy, in this case is greater than if you just had chiropractic or you just had laser therapy alone. So Choice Health Center has 2 locations. We're conveniently located in Dartmouth and Halifax with ample free parking in both locations. We actually are really focused on staying ahead of the curve. So one of our most successful technologies is, of course, laser therapy. However, we really work hard to provide the latest and greatest, most well-researched therapeutic technologies. So we also offer shockwave therapy, advanced wireless muscle stim, neurofunctional acupuncture, and a lot of other advanced technologies. And there we have it. Today, we're finally to the bulk of our talk today, which is on laser therapy. So we do have a lot of information to cover on laser. We're so appreciative of you being here, but we do really respect your time. So we'll keep this webinar to under 35 minutes or so of presentation time. And this is going to include a live demonstration of the laser. There is a chat button there at the bottom of your screen. So what I would prefer, just so we can get through this information, is if you type in your questions into the chat, we can take a look at them and answer them at the end of the presented material. And we want to start by explaining to you today how laser works best in our practice based on both of our years of experience. We'll explain the basic science of laser, what it is, how it works in your body to actually heal, and what sets laser apart from other commonly used modalities in our industry, and therefore who would best benefit from laser therapy. Oh, whoops, I almost forgot. I will do my best to keep this engaging. If you stay until the end though, hopefully this wouldn't be the only reason you stay to the end, but there will be a really great offer for you at the end of the webinar for people who are here live with us tonight. So hopefully that's not the only reason you stick around, but in case you're looking for something, then there you have it. So at this point, here we go. The healing effects of light, low intensity laser therapy, and I'm going to pass it over to Dora, who's going to get us started here.
What is laser? Actually, the word laser is an acronym which stands for L, light, A, amplification, S, by stimulation of, E, emission of, R, radiation. What that this means is that laser is light. That's it, just light. It is just another form of light. As you see here in this visual, which is the electromagnetic spectrum. With our laser, low intensity laser therapy, our wavelengths that we use are red and infrared light. Red light falls within the visual light spectrum, meaning you can see it right here. And about 600, 700 nanometers, to be more specific, is 660 nanometers. Our laser machines also uses infrared light, which, as you can see here, is a slightly larger wavelength out of the visible light spectrum, and is about 830 or 840 nanometers and on our laser machines.
Great, yes, thanks, Dora. So laser was actually developed back in the 1960s. So it was actually a Hungarian researcher who first noticed the biological effects of laser. He actually noticed that when laser was applied to the backs of shaven mice in his lab, that their hair grew back at a much more rapid rate than those who did not have laser applied to their hairless backs. He then went on to test healing rates of diabetic ulcers on the skin of humans and noticed that the same thing happened, a much more rapid healing rate. Low intensity laser therapy was then further developed for use in a clinical setting. So we use the BioFlex laser, which was developed, clinically developed by medical doctors, namely this guy right here, Dr. Fred Kahn. Here in not Nova Scotia, here in Canada,
Toronto.
we can say Canada. The BioFlex system is the industry leader. It's considered the gold standard for low intensity laser therapy for a number of reasons. The BioFlex labs in Toronto actually produce the most clinical research worldwide on the subject. This is an example of one of the many case studies that was done out of the BioFlex labs in Toronto. It's a nice visual here that's showing a diabetic ulcer that's healing after 21 days in an 88-year-old. So someone with a low, a very difficult, an 88-year-old would be slow to heal, and this is the effect with laser after 21 days. So this begs the question, how does laser therapy work on the human body? And how does administering laser therapy to our body's tissue work to actually heal them?
Okay, thankfully, we have learned a lot from years of research, and we can answer this very easily. Laser light is absorbed through the skin and enters the body's cells. Specifically, it gets absorbed by the mitochondria, which are small organs inside each cell that act as the energy-making factory inside of our cells. The energy that our body creates in the mitochondria is called ATP. The laser acts as a boost of energy to allow the cells to produce more ATP, which allows the body to heal at a faster rate. Laser absorbing into the mitochondria also causes an increase in reactive oxygen species, which leads to even more cellular repair and healing. And finally, there is an increased release of nitrous oxide, which is a vasodilator, and meaning our blood vessels open up. This is often what is given to patients with angina attacks. This results in an increase in circulation, decreased inflammation, and improved transport of oxygen and immune cells through the tissue.
So it doesn't really matter what type of tissue you're trying to target with laser, be that skin, hair, nerve, muscle, bone, tendon, ligament, cartilage. The same cellular effects that we just went over work within all the cells of our body. Laser does not discriminate. It works in all tissue to regenerate, repair, and remodel at a faster rate. It decreases inflammation and increases blood, collagen, and nerve supply. So this explains that, and we love this. We have it in our laser room, and it just kind of shows all of the multiple effects of laser in the body. So because laser targets all tissues, we are able to help so many people recover from many different conditions. So soft tissue and sports injuries, things like sprained ankles, torn ligaments, ruptured tendons, broken bones, repetitive strain injuries like carpal tunnel syndrome, tennis elbow, golfer's elbow, rotator cuff and Achilles tendonitis, other tendinopathies, inflammatory conditions. So things like lupus, rheumatoid arthritis, osteoarthritis, adhesive capsulitis, which is also known as frozen shoulder, and back problems. So things like degenerative disc or degenerative joint disease, strains and sprains, sacroiliac joint dysfunction, spinal stenosis, disc injuries, dermatological conditions like ulcers, shingles, burns, psoriasis, eczema, neurological conditions like sciatica and fibromyalgia, and so much more.
Then, Dr. Erin, would you say that laser is probably the best kept secret in our industry with a good result?
I would say that you are probably right, Dora. It probably is the best kept secret. It's definitely true that a lot of people do not realize how well researched it is. It is actually the most well-researched with the best results from the research when it's compared to other commonly used modalities, like common things like ultrasound and IFC. Laser actually has better results in the literature when it comes to controlling pain and inflammation. So the potential of laser is unfolding every day as we continue to research and learn more, which is probably the most exciting part about it.
Amazing.
The second secret about laser is how very little, how safe it is basically compared to those same modalities that I just mentioned. It doesn't really have any contraindications, except that we don't use laser on patients who have cancer or who have had cancer because of its effects of increasing cellular activity. We do like our patients to be well hydrated. The more water you have in your system, the better the results. And on the flip side of that, if you're dehydrated, certainly people who are drinking a lot of caffeine or a lot of alcohol don't tend to respond as well to laser. But because there's no electrical activity or no thermal effects, it's very safe in people who have metal in their body, like say a metal plate from a broken ankle, or a pacemaker. It doesn't interfere with pacemakers. It is generally safe in pregnancy, unlike a lot of the other modalities out there. We do avoid it in the first trimester. And one of the, like in our industry, it is well known that increased use of ultrasound creates a thermal effect. And so you can have periosteal burns, which is basically bone burning after about 10 to 16 treatments. But with laser, for example, there's no risk at all of overuse. And the third secret for laser is that even though it is so fantastic, it is not actually the be all end all. So although you can get great results, plunking a laser down on wherever it's sore, it doesn't give the best results. Laser is best used after a proper and thorough history and examination that have been done by a qualified practitioner, allowing us to come to a definitive diagnosis. The way we use laser is we come to that diagnosis, and from there we relay the diagnosis to Dora, who comes up with a laser treatment plan, which may include treating both the area where there's pain, but oftentimes also involves treatment to complementary areas of the body. For example, if someone comes in with a knee issue, yes, we would treat the knee, but we would also very likely treat the nerve roots of the lower back, because the nerves that supply the knee come from the back. And those same nerves that go from the knee up to the back and nervous system to the brain to send pain messages to the brain. So a lot of the time we complement laser therapy with other forms of treatment as well, like in the case of a knee, it's a perfect example of using exercise or strengthening rehabilitation with our physiotherapist, or if it's a spinal issue, maybe some joint manipulation if indicated by a chiropractor, some soft tissue therapy by a massage therapist, nutritional or lifestyle advice from our naturopath. Really, there's no recipe. We just take it case by case, and that if it's done properly, is in effect what creates the fastest, most complete results for people. And this, in effect, is the choice difference.
Now, demonstration, we have
Yeah, so now we're into the live demo. So I'm just going to stop sharing my screen and turn my video back on. Okay. And I'm just going to spotlight that for everyone. And Dora's going to do a demonstration on me.
Then for those who doesn't they're not familiar with laser, then this is our laser machine. And we have the pads, those pads that we use to deliver the light. They are safe, very, very good. And we have 179 super luminous diodes here.
little light bulbs.
Yes.
So that's one of the many reasons why this is the gold standard laser out there, because there are so many different diodes or light bulbs.
Yes, exactly. And then we are, because of the COVID, Erin, you want to explain that part?
Oh,
That
yes. So we
this?
do, if you guys can see, it's wrapped in saran wrap because of COVID. So normally we would only have done this if someone had an open wound that we were treating. However, now everyone gets a fresh wrap of saran wrap, and that just gets disposed of because of COVID. It's a way to keep the laser very clean.
And then this is a class 1 laser. Those are the pads, class 1 laser. And it's a very low intensity laser. And we have the laser probe as well. It's a class 3B laser. For the laser probe, we need to wear protective glasses. It's the borderline between the low intensity laser and the laser that's being used in surgery that cuts. But both of them, neither one of them creates or generates a heat.
That's right.
That's it. Then we're going to do a little demonstration how to work here with a laser. As you heard Dr. Erin was telling you, it's very important when we are treating the peripheral area or where the pain is, it's very, very important to go to the root of the nerve. That's when the nerves are coming from the spinal canal. For example, Erin is having trouble with her carpal tunnel. She's having pain, numbness, and tingling on the wrist. I'm going to treat her wrist, and you are going to see this. It's very, very fun. We have the weights. We are just placing the pads on her wrist.
Yeah, these are just weights, like
Just
light weights, just to keep it still.
She has one pad just going for the wrist, and the other pad we have to, and in this way you could see, we are making the demonstration that you could see, we could work with different areas at once. And it's perfectly safe to have both areas treated at once. And how do you feel, Dr. Erin?
Fine. It's relaxing. I'm just going to move that so everyone can see.
And you can see there, she has a pad. Then she is going to have a red light first on wrist and neck. And probably she's going to have 2 pads on the wrist and 2 pads on the neck. The protocol changes, and then it could be between 6 minutes or 8 minutes each one. After the red, she is going to have the infrared light to complete the treatment.
Great. Yeah, so treatments can go from anywhere from like 30 minutes to max an hour, Dora?
Yes.
Yeah, okay.
Yes. And we could treat different areas at once. And as you see here, it's perfectly safe and there is no risk, no side effect.
That's right. Yeah, it doesn't really feel like anything, like nothing at all.
Yeah, you could be here the whole night, huh?
Yeah,
yes.
Good night.
Okay, then we keep going. And
yeah, we'll just I'll help you out, Dora. And we just have a few more things to do before we open up for questions. Right. So I'm just going to flip back to my screen share. So I'm going to stop my video, share my screen. Whoops. Sorry, guys. You get to see my crazy desktop here. We'll go live demonstration. There we are. And we'll go back into. Yeah. So there we go. So who has this worked for? Well, as we said, lots and lots of people, but we did ask 2 of our recent patients to provide a testimonial. So I guess I can read it to you. This was sent to us through email. My experience with Dora and laser therapy. I am a 57-year-old woman with fibromyalgia. I began laser therapy with Dora because I was at a dead end with no results and from any other method or treatment for management. The pain was too much for me. I discovered Dora through my chiropractor, that would be me, and oops, that should be began seeing her after my 3rd session. I felt the difference in pain. After my 9th session, I was to the point where I could wake up and start my day with no pain. How lovely that has been for me since, and what a difference Dora and her therapy has been for my fibromyalgia in my life. I now only go once a month to maintain this, but I wanted to share my story with you and maybe help change someone else's life because laser therapy really works. And then another quick testimonial here from a patient. I had been struggling for months with an issue with my piriformis muscle in my left glute. I had used up all of my physio money. I should note this wasn't at choice, and decided to see an osteopath. So for several reasons, that visit made everything worse, and the osteopath recommended I see Dora at Choice Health for some laser treatments. I was skeptical at first, especially after the first treatment, because you expect it to hurt or to feel something, so I figured it wasn't going to do anything. I was so wrong. The laser treatments have helped me immensely. I have come a long way from my first visit where everything on my left side hurt to touch and I could barely move. I am less swollen, in less pain, and am hopeful I will soon be back to normal. And that's from Lori. And how many did she didn't mention any numbers there.
Yeah, in the 2nd week, yeah, she started to feel the difference.
Okay.
At the 2nd week.
2nd week, okay. So we certainly want that for you or your loved ones or anyone that you know. That's what we're here for. If you aren't certain what you need or what they might need, if you have a loved one who is suffering, whether it's laser therapy or chiropractic, massage, physio, acupuncture, or a combination of some of those things, that's okay. The choice difference is that we do know and we will not lead you astray. We want your results to come in as downstream a way, like this waterfall, as possible. So, oh yes, we hope that you have found the webinar time well spent for you. Hopefully you weren't just hanging out in there just to get our special offer, but in case you were, here it is. If you schedule an initial consultation with us today, you will receive 50% off your first laser treatment. If you refer a friend, they will also receive that 50% off discount. So that discount is a savings of about $55, though that's pretty good. So in closing, Dora and I both want you to remember that when it comes to your health, you are always in charge and you have choices. And so that's, in closing, I would just like to point out our phone number here. We have online booking, so you can go to our website and there's a link directly to allow you to book an initial assessment with either a physiotherapist or a chiropractor who can decipher whether laser therapy is right for you. We also have our phone number here if you have any questions, as well as our emails for our 2 locations, Dart at choicehealthcenter.com or Hallie at choicehealthcenter.com. If you have questions or if you would rather book through email or phone. So in closing, I am going to stop sharing. And I am going to, oh, you know what? I am supposed to still share. I'm sorry, share that information. And all I really have to do is start my video.
Any questions now?
Yeah, I'm going to read the questions. I'll just keep that information up there. There we go. And I'm sorry, guys. Okay, I'm going to stop sharing my screen. That's easiest. I'm sorry. So the chat. Okay, Saba is asking, does the plastic wrap inhibit the effect of the laser? No, it's like light. So light can pass through saran wrap and so can laser. How many treatments does it typically take to see results?
Okay, there is a 30% of patients, they see results immediately, like first, second treatment, they see the results. But by general, the majority of people needs between 6 to 10 treatments to see just a real result.
Okay. Yeah.
And then it depends to the treatment, depends of the injury. If it's acute, very acute, then the result will be immediately. And it's different if we treat in patient for long time problem like osteoarthritis, something that is very chronic, it will be a little longer.
Right. And then as one of the, as the fibromyalgia patient mentioned, you know, she's choosing to, after going through her life in this amount of pain, it is, you get somebody's inflammatory levels and pain levels down, and there is like a cyclical response to chronic pain. So there are often times where we do choose to, we opt to treat something chronic like fibromyalgia or ongoing with maintenance care. And
yes,
so that would be something to consider as well. Look at all these questions. It's awesome. Why don't you wear protective glasses when the light is red?
Because that's not necessary. The only time we wear glasses is when we are using the laser probe. That's the laser that it could damage your eyes, any part of the eye, from the cornea to the retina. And that's the only time it's been advisable to wear protective glasses. And we do have it. We have the glasses that is 100% protection when we are using the laser probe. With the pads, there is no risk at all, and it's not necessary to wear glasses.
Okay. You mentioned avoiding laser treatment for those who have had cancer. Is that a lifetime or for a specific period after the patient is cancer-free?
It's mainly we are avoiding the laser on the tumor, to work on the tumor.
Right.
Yes, that's mainly the big no.
Yeah.
But the patient had cancer and he's in remission, and we are not working on the area that the cancer was before, and the patient needs the treatment, is somebody that is in pain, somebody that is been having every kind of treatment, nothing help, and then we could treat the patient with in remission.
Okay. Would you encourage patients to increase fluids before a treatment?
Oh, yes.
Mm-hmm.
Yes. It's very important. Laser works at the level of the cells, remember? And when you have an inflammation, one of the components of the inflammation is lactic acid. That lactic acid is being pulled out from the cell and going to the bloodstream. It's very important that when it's going to the bloodstream, it's going to find a very well hydrated
Okay, yeah, makes
system.
sense.
And patient is going to the bathroom and is going to put in the bathroom the lactic
The
acid.
bad stuff.
Yes.
Okay, so someone again had asked about cancer. So we clarified that. It's more an active cancer and it's more over the tumor. And I mean, certain cancers are different too. There's a lot of research on that, so it's honestly a case by case as a basis as well. Over here in the Q&A, we have another question. What are some of the more common issues people come with? And what is the most difficult issue you've encountered? How long is the wait time to get an appointment and cost? Is this covered under medical plans? So I am going to answer the last bit. How long is the wait time? It's really not long. Dora, we have a number of lasers, and with Dora working with us, we're able to be fairly accommodating with getting you in within a day or two max. And is this covered under medical plans? Yes, it would be covered under, because Dora is a technician, laser therapy is actually just like another modality for a chiropractor or a physiotherapist. So no different than us applying ultrasound or IFC or acupuncture. It's billed under your chiropractic or your physiotherapy. Now, you can do this, Dora. What are some of the more common issues people come in with, and what is the most difficult issue you have encountered?
The most common is the sciatic pain. It's very common, the sciatic pain. And rotator cuff pain. Is the rotator cuff?
Oh, rotator cuff.
Rotator cuff, yes.
Like-
Carpal tunnel is very common.
Okay.
Neck pain.
Mm-hmm.
Those are very, very common.
Yeah.
And knee, osteoarthritis, knee.
Yeah.
And ligaments on the knee.
Mm-hmm.
Anterior, medial, you count it. Those are the most common. It's almost every day.
And what's the hardest or most difficult kind of case?
The most difficult I found so far for me, and it's been difficult, the herniated disc.
Oh, they're always tricky.
They are, yeah, they're very difficult and very challenge. But we love the challenge and we take it.
Yeah, and together, that's definitely a case that makes working together makes all the difference with a herniated disc. Great question from Ashley. Can laser help with healing after surgery?
Oh, yes.
100%. Yeah, big time. It's so recommended, like any surgery. And a lot of times, people don't think of going to their chiropractor or even their physio, but less so chiropractor after a surgery. But there's so much that we can do. Laser is definitely number one. But even from a naturopathic perspective, post-surgically, your body can benefit from certain IV vitamins that can expedite your healing. And yeah, laser, though I'm getting on a tangent because I've had a number of surgeries and I'm just thinking about how much choice has helped me. But laser is definitely going to help improve the speed as well as the quality of healing post-surgically.
Yeah, because increase the collagen production, remember, with laser.
Yeah.
And all the cartilage production is faster.
Faster healing and higher quality of tissue healing. And also notably, if your surgery was on, say, joint replacement, laser is safe. And, because there are no heating or thermal effects, if you had like a broken ankle that needed surgery and you now have a plate in your ankle, then laser is fair game versus putting some electric current through there is not. Is it also helpful for organ inflammation due to known existing conditions? Organ inflammation.
Probably Ashley is talking about autoimmune diseases. Yes, laser is good for them because it will improve your immune system, and it will help you to fight any inflammation in the body. And of course, as we said before, it's not the end at all. It's with the combination laser with a naturopath, that will be the best.
Yeah.
Um,
Yeah, we didn't mention it. I'm just looking to get my cells right here, but yeah, it increases macrophages, neutrophils, and
Yes.
lymphocytes. So those are your immune related cells. So if that's kind of where you're going with that question, Ashley, then it's, again, because it is very safe. As Dora says, in conjunction with a thorough plan, it would be a good adjunct to care in a lot of cases. So yes, any more questions? Q&A? I think I got that one. Yep, I got that one. And I should note that if you're just more comfortable unmuting yourself and asking, or if you want to just tell us something, you may do so now that we're done the presentation. Otherwise, we did plan for this to be about a 45-minute talk, so that's fine too.
I just want to jump in and say thank you to both of you for presenting this tonight. It was very thorough, very engaging, and certainly I'm excited because learning a new modality that can help clients to heal, especially with inflammation that I see a lot of with thermography. So really excited, and thank you so much. I found this very helpful.
Awesome. Thank you,
Thank
Catherine.
You. I'm definitely going to book myself an appointment when I'm there too, because I want to try it out.
Awesome. Very good. We'll see you in April.
You bet.
Trust.
Yeah, absolutely. Well, I'm sending my son. I just texted him the information. So he lives right there in Dartmouth. So he needs some neck help, Dora. So I'm sending him along.
Yeah, if you refer him, he'll get that 50% off. He just needs
perfect.
to stay. Okay.
Right, thank you. Thank you.
All right. Oh, Betty, thank you. I'm so glad to see that it's working and helping you.
Yes, that's amazing, Betty. Yes, I know. It's so rewarding. And something that I would love to tell you, we need a lot of patients with fibromyalgia.
Oh my gosh, yes. In the past, I used to, years ago when I was just getting started in practice, I would say I really struggled with chronic pain patients like fibromyalgia. I had a lot of really like heavy duty, heavy-handed techniques. And after all of these years, I now know exactly how to treat chronic pain. And laser is a huge part of that. So yes, don't be afraid if you have something that's chronic or tricky, and or if you know somebody who's been suffering, it's like the perfect case for us. And we'd love to help try and change someone's life.
And shingle. We are shingle season. I hear so many people are out there with shingle. Laser will heal shingle in no time. Then that's the other modality. If you hear somebody with shingle, tell them there's no reason to suffer. Go and get laser.
Saba had no idea about shingles. Yes.
Yeah, I didn't know that either. That's great.
Yeah, post-herpetic neuralgia is another one. Yeah, related to shingles. So.
We recently have a patient. She healed her herpetic her rash in 3 treatments.
Nice. Wow. Why suffer?
Why suffer? Exactly. Yes. And then Kathy is, and that was Betty. Thank you both. Laser is working for me. That's
Mhm.
great. We
And
just
Roy, after 4 visits, a lot of relief. Thank goodness. That's awesome to hear, Roy. Dora suggested that I use the laser on my hands for my eczema due to all the hand washing. Yes, it's
Yes.
made a huge difference. And now I just use the laser for maintenance. That's wonderful, Ashley. Thank you very much for doing this webinar and providing such great information. Great. Awesome.
Okay,
No
that's
problem.
great.
It was fun.
It was fun.
We'll see you guys soon. And again, don't hesitate to reach out to us at Choice Health Center. You can find us online. Take care.
Okay, thanks a lot.
Bye.
Take
Thank
care.
you.
Bye-bye.
Bye-bye.
Bye.